Hello, this is Aaron Claiborne with Wisconsin Voices for Recovery. Today I have Allison with me to share her experience about stigma. How you doing today, Allison?
I am doing great, Aaron. Thanks for asking. How are you?
I'm doing well. Thank you for asking. So now if you could tell me, what would you want people to know uh, and remember about those who are seeking or in recovery?
Yeah, I chose this question being a healthcare provider. I've been a family medicine physician for 20 years, and I think over the past 10 years, the definition of addiction and a use disorder has really been evolving. And the way that we treat substance use disorder has been evolved. It's not just the one size fits all. And people sometimes may not succeed the first time around. And it's not a moral failing of the patients. It may require more than one way of treatment, and everybody sometimes requires different things. So when I was learning about addiction in my training 20 years ago, I think it was very minimal. And most of the time we were thinking of it like, oh, they just need to stop. There's a problem with the patients, not really understanding what the characteristics of people who use drugs or use alcohol or even use nicotine, what that does to the brain. And we now know that this is much more complicated. Over the years, we've been doing a lot more research that it's genetics, there's alterations to the brain pathways, and it's due to trauma and social situations. And we need to understand this more when we're treating folks who have a use disorder in order to kind of get them into treatments. So, I do think that there's a lot of stigma in healthcare. Many people who use drugs or alcohol know that, and they don't engage with the healthcare system because of that. They may have been seen in the emergency room, they may have been seen in the primary care realm, and they may have not had a good experience. So why would somebody go back? So we really need to overcome this. We really need to train our providers on harm reduction and how to engage patients who use drugs and how to use drugs safely. We need to train our medical students and the next generation of healthcare providers on addiction and stigma. And we need prevention as well for our teenagers and our young adults, so they can also learn skills to deal with difficult times and not use substances to help them. And I think kind of addressing all of this stigma in the healthcare system, I think would help patients engage with healthcare and hopefully eventually, with getting treatments.
That was very well said. You covered a lot of points. That was awesome. And that's great information for the people in the recovery community and healthcare providers as well to know. Thank you for taking the time to share your experience today. That was very well put together. Do you have any? Yeah, of course. Do you have any final thoughts in our last minute or so that you'd like to share?
Yeah, my final thought is what I'm learning treating people with use disorders is that it's not so easy, and patients are trying, and it may not be perfect in the beginning, and they may relapse just like another chronic illness like diabetes or the illness sometimes creeps back. But knowing that these patients are trying to build new coping skills and not use drugs, or even if they're using less but they're still using, is success. And that is something that I think I just would want to mention today.
Awesome. Thank you so very much, Allison.
Awesome. Thanks for having me.
Thanks for sharing.
Okay.
It was great. So everybody, please check back in every day in the month of July to see others sharing their experience about stigma. Allison, thank you again and have a great day.
You too, Aaron. Take care.
Bye-bye.
Bye-bye.